World Health Organization has declared a new Ebola outbreak in the Democratic Republic of Congo. This highly contagious hemorrhagic fever has been spreading for months, according to WHO officials. The outbreak was officially announced last Friday, marking the 17th time Ebola has struck the DRC. With over 600 probable cases and 139 suspected deaths, the situation is serious. The virus's presence in Central Africa is raising alarms, but experts stress that the risk remains low for the rest of the world. The WHO is closely monitoring developments and coordinating with local health authorities to contain the spread. While the Ebola outbreak poses a high risk in the Democratic Republic of Congo and neighboring countries, the World Health Organization assures that the global threat is minimal. After a meeting of its emergency committee, the WHO assessed the epidemic as high at national and regional levels, but low worldwide. The European Commission echoed this sentiment, stating that the risk of infection in the EU is very low and no special measures are needed for Europeans. This distinction is crucial for understanding how outbreaks are managed and how international agencies respond to public health emergencies. Ebola has been a persistent threat in Africa for decades. Over the past 50 years, the disease has claimed more than 15,000 lives across the continent. Each outbreak brings new challenges, especially in regions with limited healthcare infrastructure. The current surge has been declared an international health emergency by the United Nations Health Agency. The history of Ebola underscores the importance of rapid response and international cooperation to prevent further loss of life and to contain the virus before it spreads beyond regional borders. Outbreak in the DRC is suspected to have caused 139 deaths from around 600 probable cases. WHO officials expect these numbers to increase, given that the virus circulated undetected for months. The delay in detection has complicated efforts to trace contacts and isolate cases. As more data emerges, health authorities are preparing for a rise in confirmed cases and are working tirelessly to prevent further transmission. The situation is evolving, and ongoing surveillance is critical to understanding the full scope of the outbreak. WHO Chief Tedros Adhanom Ghebreyesus explained that the outbreak likely began months before it was officially detected. This delay has allowed the virus to spread further, making containment more challenging. Technical officers at WHO believe the scale of the outbreak is larger than initially thought. Early detection is vital in managing infectious diseases, and this situation highlights the difficulties faced in conflict-torn regions where healthcare access is limited and surveillance is difficult. Bunia, the main city of Ituri province, hospitals are only now receiving equipment to isolate suspected Ebola cases. Nurses are beginning to get full protective gear, but resources remain scarce. Salama Bamanoba, a youth organization representative, described how graves are dug and bodies buried without gloves or any protection. These conditions put healthcare workers and communities at greater risk. The lack of adequate supplies and training in remote areas makes it harder to stop the virus from spreading. On Sunday, the WHO declared the outbreak a public health emergency of international concern, the second highest level of alarm under international health regulations. However, WHO Chief Tedros clarified that the situation is not a pandemic emergency. This distinction guides how countries and organizations mobilize resources and coordinate their response. The WHO continues to support affected countries, emphasizing that it does not replace their efforts but provides guidance and assistance. European Commission in Brussels has reassured citizens that the risk of Ebola infection in the EU is very low. There is no indication that Europeans need to take specific measures. This statement reflects the confidence in current containment strategies and the effectiveness of international health regulations. Monitoring and communication between countries remain essential to prevent any cross-border spread and to keep the public informed. Ebola epidemic is unfolding in the heart of a war-ravaged region. Conflict in Ituri province complicates detection and response efforts. Hard-to-reach areas and ongoing violence make it difficult for health workers to access affected communities. The WHO has highlighted these challenges, noting that the outbreak's complexity is increased by the region's instability. Despite these obstacles, teams are working to trace contacts, isolate cases, and provide care. This outbreak is caused by the rare Bundibugyo strain of Ebola, which does not show up on tests for the more common Zaire strain. The lack of vaccines or specific treatments for Bundibugyo limits options for controlling the virus. The WHO is examining whether any candidate vaccines or treatments could help. But for now, the focus is on cutting the transmission chain through contact tracing, isolation, and care for all suspected and confirmed cases. No vaccines available for the Bundibugyo strain. Containment relies on traditional methods. The WHO's priority is to cut the transmission chain by tracing contacts, isolating cases, and providing care. These measures are essential to prevent the virus from spreading further. Health workers are trained to identify symptoms, manage suspected cases, and protect themselves and their communities. The effectiveness of these strategies depends on timely action and community cooperation. Travel restrictions have been imposed to limit the spread of Ebola. The U.S. is screening air passengers from outbreak-hit areas and has temporarily suspended visa services. Bahrain has announced a 30-day ban on visitors from the DRC, South Sudan, and Uganda, whose emergency alert and response director emphasized that all contacts and cases should not travel. These measures are designed to prevent the virus from crossing borders and to protect populations in unaffected regions. So far, 51 cases have been confirmed in the DRC's eastern provinces of Ituri and North Kivu. 2 cases have been confirmed in Uganda's capital, Kampala, including 1 death. A U.S. doctor who contracted Ebola in the DRC has been admitted to a hospital in Germany, where his family will also receive treatment. These cases highlight the importance of international cooperation and medical support for affected individuals. Experts are investigating the origins of the current outbreak. The first identified case was a nurse who visited a health center in Bunia on April 24. The WHO was alerted to the emergence of a highly lethal disease on May 5, and the first positive Ebola test came on May 15. Understanding how the outbreak began is crucial for preventing future epidemics and improving detection methods. WHO has faced criticism from the United States over its response time. U.S. Secretary of State Marco Rubio claimed the WHO was late to identify the outbreak. WHO Chief Tedros responded, explaining that criticism may stem from a lack of understanding of international health regulations and the organization's responsibilities. The WHO supports countries in their response, but does not replace their efforts. This dialogue highlights the complexities of global health governance and the need for clear communication.